Now, when we're talking about hip pain, we're talking about there's several different spots it can show up. We're talking about it can be the outside of the hip right here. It can be just above the butt cheek, or it can actually be due to an entire pelvic imbalance that's coming from the low back. So let's talk about the outside here first. So if you're having pain that's in the true hip, that's actually in the ball and socket joint. And if you don't know anything about how the hip works, if you stop and think about how the hip wears out, you can look at someone who's had a hip replacement. And do they usually get both hips replaced at the same time? No, they usually have one bad hip and one good hip. And the reason why one hip is bad isn't because there's bad genetics or anything like that. It was because there's an imbalance on how the muscles are controlling the hip. Because the muscles in the front of the thigh, and the back of the thigh, and the inside of the thigh, and the outside of the thigh, they should all work in harmony in order to keep that ball and socket nice and steady and nice and even. But what happens is it can start to do this. If those muscles get out of sync with one another, how they're controlling, it'll grind. And that'll grind the inside of the hip, and that'll literally wear out that socket joint, and that's what starts to wear down the hip. That's what leads to arthritis. And so a lot of times the approach is to start doing strengthening exercises for the muscles that are weaker, and then stretching the muscles that are over tight, and that seems to make sense. But the problem is a little bit more upstream from there, because why were those muscles out of balance in the first place? Because the other side is fine. Why is the other side not wearing out? Why is there no pain in the other side? Well, it's because the nerves that are going to that are controlling that the ball and socket joint, those are the same nerves that come out and they go all the way down your legs. If you've heard of that sciatic nerve, that's the nerve that goes all the way down your leg, and it has a branch that comes out and it goes to the hip. So it's actually out of the control of the nervous system. It controls those muscles and allows them to move the way they're supposed to. So if they're out of sync and out of harmony and out of coordination, and some muscles are acting too strong, other ones are too weak, it's actually due to the nervous system that's firing wrong. The nerves aren't working well. So where do those nerves come from? Well, they come from the spine, and they exit the spine. So if there's imbalances in the spine, guess what can happen? You can have irritation in those nerves, the communication can be less than perfect, and now problems start to arise on how that hip works. You do that for weeks, months, years, guess what happens to that hip? It starts to wear out faster than your body can heal it. Because remember, your body is always healing, but it wears it out faster than it can heal. So the solution is working to make sure that communication is appropriate, and guess what happens? Now you're putting in less damage, because now the muscles can start to stabilize, and now you're not rocking that hip all over the place, and it starts to now work smoother and better, and it starts to glide the way it's supposed to, and it allows the healing to occur in the hip. It's the coolest thing. So we'll have people that are on the verge of needing hip surgery, and they often will not need the surgery. They can delay it and their body can heal. Doesn't happen for everybody, but it's a surprising number of people who are having bad hip pain who can actually heal from that, as long as we address the root cause. Now, the other type of issue that people could have is the one I said right above the buttock. That is where your SI joint is. And that's the joint that basically stabilizes your pelvis. So your whole body sits on top of your pelvis. And there's a joint that acts kind of like a spacer for all the pressure. And what can happen is that can start to get a little bit bound up. It can actually start to be pinched in. And when that happens, that can cause a lot of pain. And that goes all into this low back, pelvis, hip region, and it causes a lot of people much grief. And we see that very commonly, and it's something we can even see in x-rays, and it shows up, the whole pelvis starts to get torqued, and it's something we see with a lot of success in our office. And then the other one is an overall imbalance in the spine. So imagine that you're carrying your center of pressure, instead of nice and even, distributed evenly over your hip joints, your whole center of pressure is kind of cocked off to one side. What's that gonna do? It's gonna lend to have more wear and tear on one side of your body than the other, and that'll affect the hip, and we'll see that often as well. So it's kind of more of a global postural imbalance that leads to that hip having more stress on it, and then it starts to wear out that ball and socket joint faster as well. So we have to correct that spinal imbalance, and then the nerves start to communicate to the muscles better, and then we start to see that balance come back, and then the pressure comes off of that hip. So, and these are the three most common scenarios we see. We can't help if people have avascular necrosis, if they got a hip fracture, obviously, but the most common reasons people have hip pain are things that we can address in the office at its source, and most of those people wind up with really good results, and they're really happy, and they're staving off surgeries, they're getting off of medication, and they're just living a happier life, not having to worry about the hip pain hitting them, throughout the day or even while they're trying to sleep at night. So if you're dealing with hip issues, come on in, we'll get this checked out for you. Otherwise, send this to a friend that you know is dealing with hip pain. If they're complaining to you, say hey, here, check this out. It might be something good for you, because we see a lot of success in our office with this, and you might just change their life for the better by sending them this video through message. So look forward to taking care of you guys. I'm Dr. Lee with Ignite Chiropractic, and we'll see you soon.